Hello, welcome. I am Dr. Genao, and I work as a geriatric medicine doctor at Duke. I am here to talk to you today about medications that you should be careful or completely avoid in your loved ones. The term is the Beers criteria. The Beers criteria is an implicit list of medications that was created by Mark H. Beers in 1991. The American Geriatric Society, since 2011, has been the steward of this list and creates updates every 3 years. The intention of this list is to improve the selection of medications that are routinely used in older adults, educate clinicians and caregivers on what medications are appropriate and what are inappropriate for older adults, as well as reducing the adverse drugs event or effects that are not desired from a medication. We term potentially inappropriate medication those medications who are being prescribed without an indication, or if they do have an indication, the benefit of the drug is less than the harm that it will do. The latest update for the Beers criteria was in 2019. It was created by an interdisciplinary panel of 13 experts that come from the community, nursing homes, clinics, pharmacists, that reviewed all the evidence available since 2015 and summarized those recommendations by level of strength in the evidence. And why is knowing the Beers important to you as the caregiver? Well, you know your loved one the best. You are the gatekeeper between different providers. If you know what to look for, be it positive effects or negative effects of a medication, you can better provide a report to the clinician. And you are likely the person buying, organizing, and administering these medications, and probably want to know what you're into. And last but not least, you are the advocate and partner in care. And how are older adults different than younger adults when it comes to medications? The World Health Organization states that 1 in 9 people is 60 years and older across the world. And this number will increase to 1 in 5 by 2050. Most of the low and middle income countries, it's where older adults reside and the fastest rates of aging are occurring. And with advancing age, multiple chronic conditions occur, such as diabetes, high blood pressure, high cholesterol. And with all those comorbidities or diseases, older people tend to take multiple medications in one single day. And what happens when you take many medications? And generally, we talk about 5 or more medications a day. It's associated with about a 30% increase in spending, healthcare spending, because it increases hospitalizations and outpatient visits. Up to 10% of emergency department visits are due to adverse drug effects. We know that taking 5 or more medication increases your risk for those effects by 88%, and the risk for drug and drug interaction, that is 2 drugs working against one another, by 80%. It also increases the risk for falls. A person taking 10 or more medications is highly likely to be malnourished. And the more adverse drug effects a person has, the less likely they will be able to adhere to the way they're supposed to take the medications. And with that, the disease will get worse, we will have treatment failure, and the person will end up in the hospital. Multiple medications also is associated with a reduced ability of one to take care of oneself. And again, why is this? Well, as a principle, drugs are flushed out of the body through the kidneys and the liver. And as age progresses, these organ functions are reduced. Drugs can also compete for being metabolized in the liver, resulting one drug to be cleared more slowly than the other, and therefore creating more toxicity or harm in the body. Another reason is two drugs from different names can be doing the same thing. For example, a person could be taking aspirin and then a blood thinner. Both of those tend to make you bleed more. So the more you take of those, the more likely you will have the adverse effect. The other element that happens uniquely in older adults is that the proportion of fat cells in the body increases, even if you exercise every day or even if you're not overweight. It's just a total change in body composition. Some drugs, especially those who create sedation, they make you sleepy, are stored in those fat cells. Therefore, if even with very low doses of the medication, an older person is more likely to have effects that are adverse from those medications. So what are the medications that you should avoid taking and that you definitely need to talk to your healthcare provider about? I'm going to give you a list of medications, but know that your healthcare provider is the person who knows why your loved one is on these medications. Know that the fact that they're in that medication doesn't mean that they need to come off of it. You just need to talk to your healthcare provider about it. So I'm going to start with what we call anticholinergic drugs. Those are drugs who we use for medications for allergies or medications for sleep that are over the counter. Also medications that we use for back spasms or for urinary, you're going too much to the bathroom to slow that urinary frequency down. Those medications are known to cause something called confusion or delirium. And I'm going to stop there because this is the most important side effect or adverse effect that you should be careful with. Delirium is an acute change in 48 hours, 2 to 3 days in mental status. The person doesn't know where they are, what day of the week it is, who their loved one is. They may be seeing things that are not there, listening to voices. It's a very sudden change in the level of alertness of a person. And it can be related to the use of medications. So be very careful with when delirium or confusion comes up. Other side effects from those anticholinergics include dry mouth, constipation, inability to urinate, you retain urine. And all of this happens both because the person who's older is more susceptible to this, but also because their clearance is reduced. The next big category is medications used for mood or antidepressants that have a high anticholinergic activity. Again, the word anticholinergic is something that you might want to keep in mind. One example is amitriptyline, but there are many other antidepressants that are old school and that you might need to talk to your doctor about for a safer alternatives. A third category are antipsychotics. And these are medications that are rarely used, but they're used mostly when a person with dementia is having problems with behavior, hitting staff or seeing things that are not there and they're very scared about it. And we use them just to keep them safe. But we do know that these medications increase the risk for stroke and actually can make the cognitive decline worse in a person with dementia. So we really need to be careful with those medications. The next category is the benzodiazepines. And names out there could be lorazepam or alprazolam, Xanax. This is a category of medications. Start over? Okay. Benzodiazepines. Medications like alprazolam, lorazepam, older adults are more likely to be sensitive to this and be very somnolent. Again, this is one that can cause delirium. It increases the risk for falls. We know it increases the risk for motor vehicle accidents and emergency department visits. There's also the Z drugs, or those drugs that you hear in the television that help you sleep, like zolpidem or zaleplone. Again, those medications are unlikely to improve your sleep and can cause significant confusion. Another one is estrogen in postmenopausal women. Estrogen taken by mouth increases the risk for cancer in the uterus and breast cancer. And it does not protect your heart, and it may increase your risk for forming clots. So again, taking estrogens by mouth is something that you want to discuss with your healthcare provider. Another medication is megestrol or Megace. It's a medication that is used for appetite stimulation. And we know that it doesn't increase the weight on a person taking it, and it increases the risk for clots and actually death. So it's something that we don't recommend. The last three categories, some medications for diabetes, talk to your doctor about it, but some of them are cleared by the kidneys, and a person can have prolonged low blood sugars, and that is very dangerous in an older person. The proton pump inhibitors, you know them by Nexium and medications for reflux. If taken for more than 8 weeks in a row, we know now that it's associated with increased risk for fracture, so it's not recommended long-term use. Last but not least, aspirin and all the alikes, ibuprofen, naproxen, and all those medications that are anti-inflammatories that are sold over the counter, they can cause significant risk for bleeding in the stomach, for an ulcer in the stomach. They raise your blood pressure, and they can actually damage your kidneys even in a permanent manner. So really be careful and talk to your doctor when you take those medications. There are many more medications in the Beers criteria. Again, this is why this is targeted for doctors. Just know that there are drugs that interact with a specific disease like Parkinson's. There are drugs that interact with one another. And there are drugs that need to be reduced in the dosing when you have reduced kidney function. So again, talk to your doctor about this. And why should you believe me? What is the evidence out there? Well, let me tell you, just this latest review from the American Geriatric Society, they actually searched over 17,000 references and selected 1,400 to full text review. I mean, they read the entire paper, they reviewed the evidence, and actually summarized it and qualifies in levels of evidence. And they use that evidence together with how often this medication is used or how often the effects are, and they come up with either a weak or a strong recommendation. So lots of hours of work. All the medications that I mentioned earlier are high quality and strong evidence for it. So what are reputable resources of information? Number 1, your local pharmacist. Number 2, your local pharmacist. Number 3, your local pharmacist. Talk to your pharmacist. They're very knowledgeable. So I would start there. There's also the healthyaging.org. There's a list, tips to avoid over-medication. And their recommendations include ask before taking any over-the-counter medication. Make sure you make a list and keep it updated. Review your medications twice a year with your healthcare provider. Ask questions about your medications. Organize your medications and follow directions carefully. Report problems to your doctor. And then there are several don'ts. Don't take medications that are not prescribed for you. Don't use medications that have passed their expiration date. Don't stop taking medication just because you feel better. Don't drink alcohol with medications that are given for sleep, anxiety, or depression. And the last one, but the most important one, never stop a medication without talking to your doctor. It can actually be very, very dangerous because some medications need to be slowed down or tapered. Again, many times I see patients end up in the hospital because they stop their medication suddenly. So please be careful. Another good resource is the NIA, National Institute of Aging or National Institute of Health Resources. There's a list that says questions to ask your doctor about a new medicine, and it's 14 questions. So what are some questions that you can ask your doctor when they're prescribing a new medication to your loved ones? First, what is this medication for? Is this medication in the Beers criteria? What is the proper dose that we're starting the medication on? Are we ever going to go up on this medication? What should I look for? What are the effects that you want from the medication? And what are the effects that I need to be careful about? How much does this medication cost? Should I take it in an empty stomach? Should I take it with food? Does this medication interact with any other medication? Can this medication increase the risk for my loved one to get more confused, or to fall, or to have difficulty sleeping? Is there any other alternative for this medication? And obviously, the one that I'm going to suggest is this medication on the Beers criteria list? I think if you keep that list of questions and you actually keep it written down, you will be the best steward for your loved one in terms of preventing adverse effects and knowing whether a medication is indicated or not. Because even if we started it today, that doesn't mean that it needs to stay forever. So knowing that and reviewing it every 6 months is going to be very important. So let me give you an example. Let's say this is a 75-year-old man who comes and he's having some knee problems. And he says, well, doc, Tylenol is not cutting it anymore. And the doctor says, well, okay, let's start trying some ibuprofen over the counter. But doesn't necessarily tell him how many, how often, or anything. And he just goes home and let's say he takes 3 ibuprofens 3 times a day for about a week. And then he just doesn't start feeling well. His stomach is hurting, so he just messages his doctor in my chart, my stomach is hurting. It's probably is irritating your stomach, so let's add a medication to protect your stomach. Something like, I don't know, Nexium. And he keeps taking his medications, and then he has a checkup with his doctor. The knee pain seems to be better. And when he goes to his doctor, all of a sudden, his blood pressure is 180, very high. And this is a gentleman without any blood pressure medication. So the doctor just says, well, you have high blood pressure now. Let's add a blood pressure medication. And let's say we added hydrochlorothiazide. Don't worry about the name. It's a high blood pressure medication. 3 weeks later, he starts feeling dizzy and he falls. He's taken to the emergency department and he broke a hip. Okay? This is a classic example of what we call a prescription cascade. The patient in the beginning started having some knee pain, and we prescribe anti-inflammatories, which when do it on a limited basis and taken appropriately may be a safe alternative. But it's possible that in this case, it could have caused high blood pressure, reduce the stomach absorption of calcium, weaken his bones, and increase his risk for a bleeding ulcer, okay? And instead of us going ahead and stopping the anti-inflammatory, we just went ahead and added another medication that was probably not necessary. And that blood pressure medication dropped his blood pressure so much that he actually fell and broke a hip. And now something that it was a simple knee pain ended up in an emergency department visit. So that is an example where we just need to be careful when we're adding medications to a list. Another example is, for example, when somebody is discharged from the hospital and This is the list that was given in the hospital. And you go to your first doctor's appointment and you just bring the list and you tell the doctor, and the doctor asks you properly, they want to do a medication reconciliation. What are you taking? I have the list. Nobody brought bottles. Nobody brought any medication. So for all we know, you're taking what the list say, but very likely that person didn't necessarily check the list and was taking older medications, and the doctor might add a new medication. And so those medications could interact. I see that often happening with medications for blood pressure, medications for diabetes. And so you can overdo it easily if you are not careful about a very accurate list and you bring either the bottles and the list to your doctor to review it with them. Another one is, again, along those same lines, a person who is being managed for diabetes and they were taking oral medications and ate a lot of cake or whatever they did and ended up in the emergency department, and we go ahead and start insulin. If we don't instruct this person to stop the oral medication and they start taking the insulin, they could potentially lower the blood sugar so much that, again, they either end up in the hospital or could potentially even die. So again, be careful anytime you introduce a new medications, because remember, a person who's older tends to be more susceptible to the effects, tends to accumulate the medications more, and you simply are taking more medications, so there's more opportunity for confusions between different healthcare providers and fractionated healthcare. Again, talk to your doctor and never, ever stop a medication without talking to your doctor, because it can be very dangerous. Thank you so much.